You know, what is a critical point that you just said triggered giving a child a tool to, it's such an empowerment, you know, it's such a feeling of control, it's such a feeling of, yes, I can manage this and I can respond to this. So not only are you, what I'm not admiring quite a bit about PAC-NJ is not only is it teach the child to manage it, but it's also providing all of these other resources that surround the child to help them be able to step in as needed and add the further control of the situation. I'm wondering if we can touch a bit on the environment. And you've mentioned, you know, buses idling in schools, and certainly that has been banned and is one of the criteria for your school awards. But what are some of the other environmental triggers, you know, in terms of ozone layer, in terms of extreme heat? Are those also common triggers for children with asthma, or adults with asthma, certainly?
Yeah, if you look at some of the things in terms of temperature, 20-degree drops in temperature, which typically happened this winter a lot, on and off. We kept getting these warm days and cold days, is a trigger for asthma.
So
high ozone days, which is the part with the heat. When it's hot, it's not the heat itself that's an issue. It's the heat gives us temperature inversions, and the ozone, we collect a lot of ozone lower on down, which is essentially an air pollution problem. Air pollution, both outside in the form of ozone or inside in the form of cigarette smoke, not only causes airways to get hyperreactive, even in non-asthmatics, but it's more critical for asthma. But these things also make you more likely to develop asthma or to get other respiratory illnesses at any age.
Okay.
So it's a double whammy.
Interesting. And in terms of those issues being triggers, are there some suggestions that you make, Sandra, in your roles to, like, what can people do to avoid that? You know, if you have to be outside, and what do you suggest for people when kids want to go out and play and it's a hot day, or it's...
Well, there's a lot of time spent at movies in the mall on the days when they give warnings for if you have asthma and you shouldn't be outside. It's easier to find something to do inside for that day. And there's also, you know, speaking with your physician to find out what you need to do in order to pre-treat and how to avoid those things. You really have no control over the ozone or the heat.
Right.
So you usually try to avoid what's causing your asthma.
Right, right. Now, are there some other programs or initiatives about that PAC-NJ provides in the community that you'd like to highlight?
Yeah, the child care, right?
Yeah, we're now getting involved with child care. We started off again in the school setting because we can have clout there. School stuff was mandatory. But with child care becomes important as well. Again, that's where asthma is growing in little kids. And once we got the school pretty much settled the way we wanted to, we began to go into the child care area. That's where kids are before they go to school. And that's more voluntary. There's no state mandates, essentially, that area. But more and more child care providers are definitely willing to go on board and to start doing this because more and more kids are having asthma. And it becomes a problem in the school setting.
Now, I think I understood or saw that there have been 50 child care centers in the state that have taken part in some kind of awareness training
and that'll be growing more and more. And again, that's one of the advantages of having all these volunteer agencies. Each agency and each person in it that's involved with PAC offers what they can offer, and together we can do a whole lot more than any one agency or individual could do on their own.
Absolutely, absolutely. So I think some of the key messages here for viewers to take home is, one, certainly the changes that are happening. Speak with your physician. Identify what the triggers are with your healthcare provider, but then they can go on to, they can actually start with our website, which we'll be providing, and we'll provide links to both of the organizations as well as the ALA to identify how to better manage those triggers and how to just give an ongoing control. Is there anything else you'd like to add, Sandra, in terms of ANMA and what you're working on that in our last minutes? Well,
we're working on a lot of different things. ANMA is actually holding an advocacy day, and we have several New Jersey residents joining us May 5th, 6th, and 7th down in Washington. We'll be talking about the issue of the inhaler change and going up for our 11th annual Asthma Awareness Day, Capitol Hill, which we do every first Wednesday in May. We go up to Congress, meet with our members, and we hold asthma screenings, and people are able to come in and learn what they can about asthma. And I guess that would be my message to anybody listening to this program who is either has asthma themselves, their child has it, or they're touched by asthma. Learn as much as you can and work with your medical provider, because asthma does not have to interfere in your life. It can be totally controlled.
Excellent, excellent. Doctor,
and on the basis of that concept of
left?
control, we have new NIH guidelines. Again, I talked about they came out in 1991 that talk about control is really the issue for asthma now. About 75 to 90% of the patients who have asthma really have persistent asthma. That means without medication, they would have symptoms more than a couple times a week, or they would have severe episodes more than once a year.
Right.
Those patients need to take medication on a regular basis, not the bronchodilator medications
Right.
that you
Not
use
the
for symptoms,
quote-unquote rescue.
but controller medications like inhaled steroids in order to keep asthma under control. The goal is not to treat a symptom. The goal is not to have the symptom.
Right. Excellent. Thank you both very much for it's very important information. We will be sure to provide links to, again, both websites and provide much of the information that we discussed today as well. Thank you all so much for joining us today and hearing about this important issue. I just would like to remind viewers that we are asking you for some feedback. So if you could take a moment to please visit our website at www.middlebrookhealth.org. Not only will you be able to learn some more information about what we've been discussing here today, but there's also an opportunity to take a brief survey. We'd like to hear your thoughts about the program, suggestions you may have on other public health issues that you'd like to learn more about. Please do take a minute to give us some feedback on that. Alternately, if you'd like to call our office and offer that feedback, that number is 732-356-8090. And again, thank you all very much for joining us.
Supernatural activity and return forthwith to your origin or to the nearest convenient parallel dimension. Try to imagine all life as you know it stopping instantaneously in every molecule.
Keep good health in the spotlight. Remember to cover your cough or sneeze with a tissue or your elbow and wash your hands frequently throughout the day. These simple actions help keep everyone healthy.
I am stuffed.
After that meal, I have got to pass gas.
Powder room's right there.
No! Daddy's gas can kill us all!
That's right. Toxic clouds like the one I'm about to unleash could make everyone deathly ill. Even that baby of yours. Be right back.
Secondhand smoke contains hydrogen cyanide and other deadly gases.
What a guy.
He is a keeper.
Don't pass gas. Take it outside.